moisturizing creams which contains both
Diabetic have
grease
more
as well as
chances
the
to get
moisturizing creams.
dry skin.
So the rashes and itching also one part of the diabetic dermopathy. What is called, they have more itching, more rashes, and blebs and non-healing ulcers. These are common with diabetes. So we have to moisturize adequately. That's the cause of itching is not uncontrolled sugars. It is basically the dehydration of the skin.
One question, sir. You talked about HbA1c. So I've seen doctors accepting the fact that most of the people are pre-diabetic and it's okay, unless you have follow-up questions that are not a diabetic. So my question is that is it okay to be in the range of 5.7 to 6.4 for longer period of time, or is it possible to reverse that and come down below 5.7?
Excellent question. So it is about pre-diabetes, 5.7 to 6.4, we call it pre-diabetes. What is the fate of these pre-diabetes? If you implement strict lifestyle and strict diet to suit to the situation, 1/3 of them will become non-diabetes. Whatever you do, whatever you control, 1/3 of them will go into frank diabetes in the next 2 years. And the 1/3 will remain as pre-diabetes. But it is very well. With the little lifestyle adjustment, we can always keep in within pre-diabetes range, though the risk is little higher than the non-diabetics, normal general population. The risk of heart attack, strokes are slightly higher in pre-diabetics. They are also at risk of more macrovascular disease, what we call the heart attack, strokes and peripheral arterial disease are little higher in pre-diabetes compared to general population, but much lesser than the diabetes. The risk is lesser than frank diabetes.
This is the better test. Like fasting and BP is something which is a bit more uncomfortable. So HbA1c or these two, which is okay.
HbA1c
Short,
is
short,
a very
short,
good
short.
test, is gold standard.
Yeah.
Still there are certain fallacies in HbA1c. So if the blood cell turnover is very fast, like somebody has iron deficiency, the RBC lifespan is 120 days. It doesn't live for 120 days. By 90 days it will get destroyed, vanished, and new small child RBCs will come into the circulation. So basically HbA1c is the tag of RBC with the glucose. So it gives a wrong, it gives a higher HbA1c in wherever the blood turnover is high. Like in certain diseases like hemoglobinopathies, the lifespan of RBC is very low, 40 days, 50 days, wherein HbA1c doesn't show the exact figure. So ideal is fasting postprandial HbA1c to make a diagnosis. Once diagnosis is made, then we can follow up with fasting postprandial.
We will take up one question just now, in the interest of time.
Hello, sir. Simple question.
Yes, sir.
One is like.
I decide whether it is simple or complicated.
Okay. This is regarding hypoglycemia, which is low blood sugar. So, how to differentiate between low blood sugar and high blood sugar? I mean, because you see, I mean, you showed both of the things, having low, fatigue or, so other factors.
So excellent. This is very important for any diabetic, even for normal person should know what is a low blood sugar and what is high blood sugar. Is diabetes, uncontrolled blood, that we know. Blood sugar which is not under control. But anybody who is diabetic taking medications can get a low sugar anytime because of the medication or not eating properly or don't have enough carbohydrate content in that food. People are very much anxious sometimes to avoid carbohydrate. So if you don't give even minimum carbohydrate, you get a low sugar. By definition, low sugar is, there are two things for low sugar. One is number, that is the blood sugar levels. Second is symptoms. The numbers of blood sugar is 50, less than 54 is absolute hypoglycemia. Clearly low sugar, even the symptoms are there or not. Less than 70 is normal hypoglycemia. So for a long-standing diabetes, we should consider less than 70 is hypoglycemia, that is low sugar, and adjust the dosages accordingly. And in elderly and particularly long-standing diabetics, the symptoms of the low sugar like palpitation